Hello, my name is Reilly, critical care registered nurse, and today I'll be doing a presentation on oral care for ventilated patients in ICU. Ventilated patients in ICU are more prone to develop a pneumonia called VAP, which is ventilator associated pneumonia. This is caused by the fact that they've got an ET tube in, their mouth is propped open 24 hours a day, gives pathogens access to a warm environment, a moist environment in their mouth where they can breed and multiply, and the ET tube provides direct access to the lungs because we've now bypassed all the normal mucociliary defense mechanisms that the patient would have. So one of the things that we do to prevent the risk of VAP occurring in our patients is high quality mouth care. The way we go about the mouth care is to brush the patient's teeth with an electronic toothbrush. A small head with soft bristles toothbrush that rotates or oscillates at least 20,000 cycles per second. Research has shown that this amount of cycles per second is most effective in removing biofilm from off the teeth and below the gum margins. Research has also shown that it's preferable for nurses to use those electronic toothbrushes because they are easier to use and the nurses are less prone to worry about doing damage to the patient or the ET tube, and they only have to guide the electronic toothbrush rather than actually physically push a manual toothbrush into place to get the same effective action. The actual mode of action when using the electronic toothbrush would be to clean the outside aspect of the teeth first, then the inside, and then the biting surfaces, top, then bottom. We then clean the tongue using the electronic toothbrush, and we work our way from the back of the tongue to the front, from the inside to the outside, removing the biofilm as we go. Once we've cleaned the teeth, we need to rinse effectively, and to rinse effectively we can use either saline or we can use normal water. We rinse the teeth and oral cavity, we suction out the fluid that we leave behind, making sure that we get to the back of the throat to make sure that there's no fluid sitting on top of the ET tube cuff. So if the cuff gets changed or moved, that fluid will then go straight down into the lungs and cause a VAP. After we've cleaned the mouth, we wait half an hour and then we need to sterilise the mouth. Now the gold standard for sterilising the mouth is chlorhexidine, 0.5% chlorhexidine, available in all hospitals, all ICUs, and we just use that at least twice a day on the patients. Brush their teeth 4 times a day, use the chlorhexidine twice a day. Now we've got to wait half an hour after we've finished brushing the teeth because there are some constituents of toothpaste that can affect the effectiveness of the chlorhexidine. So it can make the chlorhexidine less effective if we don't wait that half an hour. The other thing that we need to do with patients, if they've got their mouth propped open 24 hours a day, their normal salivary glands are not working, we need to keep their mouth moist. There are commercial mouth moisturisers available. We can get artificial saliva in drops and sprays. The simplest solution is to use a simple water-based lubricant like Clinogel or KY jelly. We can use that anywhere in the oral cavity and on the lips, and we should be doing that every 2 hours to keep the mouth moist. We can do it more frequently, but at least every 2 hours. Other products are sometimes used, such as lanolin or petroleum jelly. These are not actually recommended because they can actually cause drying of the lips and the mucosa, which will allow easier access for pathogens to get into the body. Other products that are also used to clean the mouth is hydrogen peroxide. We don't recommend hydrogen peroxide because hydrogen peroxide causes damage to the mucosa and can allow pathogens to get in once the mucosa has been damaged. Similarly, that we would not use sodium bicarbonate solutions, which which are common in some hospitals. They cause damage and drying of the mucosa, and some hospitals use ready-made glycerin and lemon mouth swabs to clean and moisten a patient's mouth. Although that gives the patient's mouth a nice glossy look, the glycerin actually pulls fluid out of the tongue and dries the tongue out and makes the situation worse. So far from making the mouth moist, it actually makes the mouth dry. So what's the importance of doing mouth care for our ventilated patients? Well, we want to make sure that we can do the best possible care for our patients, and this is fast becoming one of the optimum ways of preventing a VAP in a patient. But added and above to that, there's also a financial benefit, because the cost of a single VAP to the hospital is $20,000. $20,000 for every VAP that occurs in your ICU, and it's estimated that 15% of your patients, 15 out of every 100, will develop a VAP at some stage. So the numbers add up very quickly to be a lot of money. The actual cost of preventative care, the oral preventative care, comes in at $15. $15 to do the oral preventative care that you need to prevent VAP occurring in your patients. It makes good economic sense, and it makes good clinical sense to your patient to provide the best care for them. If there's any questions, I'll be happy to answer them for you now.